Mr. Smith. I'm just gonna keep looking for an IV over here on this side, okay?
Okay.
Typing it again.
Sam, how are we doing with that IV?
I'm not getting anything. I've tried twice. I can't get anything to thread.
Okay, all right, we're gonna have to work on that. Mr. Smith,
Yes.
how are you feeling?
Okay.
All right, I'm
A little
bringing.
tired.
Okay. Imagine so. So your lab work's starting to come back. And it looks like your body is fighting a pretty severe infection. Okay?
Okay.
So I'm actually bringing in this cart. We're pretty busy today. We're not the biggest hospital. We have a pretty small ED. So we're calling in some reinforcements here, some additional members of our team.
Okay.
Hi, it's Dr. Barker.
Hi, this is Courtney Pilot from EICU. I'm a nurse in the EICU.
Great. This is Jerry Smith. He's a patient here at Regional Hospital. And he came in with a fever when we were worried about sepsis. He has an indwelling catheter from an old injury that left him paraplegic. Looks like he does have a UTI based on his labs, but he's meeting criteria for severe sepsis because his lactate came back at over 4. Looks like his blood pressure's dropped a bit since he came in. It's 91/58. MAP is still 69/65, but with that lactate, I know we have to work on that 3-hour bundle with CMS, and I thought it would be good to have you guys on board too.
Okay. Good to meet you, Mr. Smith. I'm sorry to hear you're not doing well.
Nice to meet you too, Courtney.
Yeah. So the EICU helps staff our ICUs electronically. So like our ICU here or at some of the other regional hospitals, they're like a second set of eyes and help guide ICU
Okay.
care, intensive care unit care. So we're going to give you some antibiotics, okay, to cover the urine. So looking through his past cultures, it looks like he has had Pseudomonas before. So I was going to order Zosyn for that. So if we can get Zosyn 3.375 grams, get that home. Do you have any allergies? I'll ask you one more time.
No.
Okay, so no allergies, so that's good.
Okay.
Okay, so we'll get that started. Okay, what else do we need to do for the bundle, Courtney?
So looking in the record, it looks like we're on track for the bundle as long as the antibiotics are in within the first 3 hours.
Okay.
And the fluids, how much fluid do we have in at this point?
So I think all we have is what we were starting pre-hospital.
About
How much?
200 mils.
Okay, yeah, we just had a 22 is what he came in with, and Sam's been working on that. So Sam, I think we have to get set up for an IO.
Okay.
We don't want your blood pressure to get worse. She's going to talk to you about that.
I'm gonna get
Okay.
some set
Okay,
up
that
here
sounds
in a second.
great.
Okay.
He's 100 kilos, so we'll need a full 3 liters
Okay.
for the 30 mils per kilogram.
Okay, so 3 liters then. Oh, mine away.
Jerry Smith.
Okay.
723. I can't remember.
Okay.
The year you were born?
I'm having trouble remembering that.
All right, I'll tell you. Let me take a look at the
61.
record. Okay.
61.
Okay.
Thank you.
All right, that matches what we've got. All right, so you said 3 liters of fluid. We've got the Zosyn hanging,
Oh,
and we had already ordered the
there-
lactate and the cultures. I got blood cultures, urine cultures pending. His chest X-ray looked okay. Is there anything else?
okay.
Are there any other sources of infection that we
Okay.
should consider at this point?
We did actually send a wound culture because he's got a sacral D-cube, so that's a great point. Let's add Vanc as well to cover MRSA since he's in a nursing home. Tammy,
Yeah.
can we add to that once you get that set vancomycin 1 gram?
Okay.
We'll get that
Vancomycin
started.
1 gram.
Yes. All right.
And then once that 3 liters is in, we'll want to make sure to recheck his lactate.
Okay, we'll do the repeat lactate too. Okay, great. Thank you very much.
Thank
Work on
you.
this line
I do see
here.
that you guys are really busy today in the department. Would you like me to stay videoed into the room and keep an eye on Mr. Smith?
I'm going to get the
That would
video.
be,
Okay,
yes,
thank you.
helpful. That would be very helpful. Don't you think, Sam?
Yeah,
Okay,
that would
very
be
good.
great. Thank you.
All right. All right, I need you to turn your arm in like that. Just kind of relax here. Yep, just keep it like that. Oh, look at that. and what we're gonna do, it went in nice and easy, and we're gonna check for, oh, you're gonna clean the hub, good. Okay, and, all right, we're gonna, got a good draw back, and now we're gonna flush. Okay, ready, go. There we go. Yeah, I had a little bit of pain going in there with that, but it's flushing
Is that
well,
flushing
yeah.
okay? Okay.
All right,
So
that's
I can
good.
switch
Yes,
the line over?
yeah,
Okay.
switch that to fluids.
Perfect.
Got that? All right, it's important. All right, and, oh, you got fluids for me?
Yep. There you go.
All right, and let's not, look for these fluids, let's have these wide open. Okay, we can take them off the pump.
Okay.
Okay, good. All right, just to recap, make sure you're on the same page too. So we're dealing with septic shock. By criteria, we need 3 liters of fluid, so we've got those hanging.
Mhm.
We've got Zosyn and Vanc to cover the urine and the D-cube. We already had the cultures sent. We're repeating a lactate after the 3 hours. Or not 3 hours, 3 liters of fluid.
Okay.
Hopefully it won't be 3 hours. And then I think we're good, and we'll work on transferring you, because with your blood pressure dropping the way it is, I think we'll probably want to get you to the bigger hospital.
Okay, I'll call for a transfer.
All right, great. Anything else, Courtney?
Sounds great.
All
I'll
right.
keep an eye on him and let you know if anything changes.
All right, sounds good. Thanks. Let me know if you need
Thanks,
anything.
Jennifer.
Okay.